Okay, you can start.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome everyone to another webinar for Muslim Resource Services. Today's webinar is going to be Hospice, Comprehension and Care. AMAC Hospice Team is here to tell us all about everything we need to know and to better help us understand what hospice care is. This is a part one of a part two webinar. Inshallah, next month we will be continuing with the second webinar, where we will be introducing to you a facility here that is taking the time and the effort to learn from the hospice team on how to treat Muslims. But for now, let's get started with today's program. I will be introducing to you all AMAC's hospice team, starting off with Dr. Arshia Madni. Dr. Arshia Madni is a fellow of the American Academy of Pediatrics. Arshia is married with two beautiful kids. She is a hospitalist and a palliative care physician at St. Jude Children's Hospital for the last 4.5 years. She grew up in New Jersey, but originally from India. She is a member of the American Academy of Hospice and Palliative Medicine and chair of the South and East Asian Forum for AAHPM. Her goal is to use her palliative care expertise to create programs that will aid the Muslim community in how the best care for their ailing members while honoring Islamic tradition. Thank you for being here, Arshia.
Thank you for that beautiful introduction.
Thank you.
Thank you everyone for joining.
Thank you. Next, I would like to introduce to you Dr. Nabil Bayakali. Dr. Bayakali was born in Kumasi, Ghana, to Lebanese parents of Turkish descent. He is married with 4 children and 2 grandchildren. He is an associate professor of biology, and he is also an AMAC and Muslims in Memphis board member. He has numerous publications in science, Islam, and the Arabic language. Thank you for being here, Dr. Nabil.
Thank you for having me.
Now I would like to introduce to you Dr. Shan. Dr. Shan is married and is a native Memphian who has completed a residency in internal medicine and fellowships in nephrology, hospice, and palliative care at UTHSC, Memphis. His interests include expanding access to primary care for underserved communities and helping to advocate for culturally and religiously sensitive care for Muslim patients. Thank you for being here, Dr. Shan.
Assalamu alaikum, jazakallah khair. Happy to be here.
Thank you. And our final team member is Dr. Hannah Hakeem. Dr. Hannah Hakeem is an associate faculty member in the Department of Infectious Disease and the medical director of Infectious Prevention and Control at St. Jude Children's Hospital, Research Hospital, excuse me. Dr. Hakeem received her medical degree from the American University of Beirut in Lebanon and completed her pediatrics residency at Women and Children's Hospital of Buffalo, the University at Buffalo School of Medicine and Biomedical Sciences, New York. She completed her Pediatrics Infectious Disease Fellowship at St. Jude Children's Research Hospital, La Barnard Children's Medical Center, followed by another fellowship training program in pediatrics, HIV, and AIDS. During her fellowship, she also completed a Master of Science degree in epidemiology from the University of Tennessee. She's a college graduate of the science degree College of Graduate Health Science. Dr. Hakeem is married with 3 beautiful children. Thank you for being here, Dr. Hakeem.
Thank you for the introduction. My pleasure to be here.
Thank you all. Now, it was my pleasure to introduce you all, and I'm very excited to be working with you all. We are going to start off with Dr. Arshia Madni giving us a brief PowerPoint presentation, followed by a question and answer session.
Sorry, it took a minute for me to get situated. So again, assalamu alaikum everybody, and thank you for letting us speak with you today on this really important topic of hospice and palliative care. We are speaking not only from the perspectives of practicing Muslims, but also those who are multidisciplinary backgrounds, which gives us a unique perspective and a different perspective of hospice and palliative medicine. Historically, palliative care has not been utilized by ethnic or racial minorities due to its Western roots, but the landscape of palliative and hospice medicine is now changing, and there are more culturally aware and sensitive practices that are being acknowledged and utilized by hospice and palliative medicine. So as a quick overview, what I'll be talking about today is first defining what hospice and palliative medicine are, and then describing the role of hospice care in caring for the sick Muslim. So as we know, existential distress of illness is addressed by our faith. Allah has a purpose behind everything that happens to humanity, and illness is part of his plan. We know that patience must be exercised by Muslims who are faced with calamities, and this includes illness. Distress is often experienced also by seeing our loved ones suffer, and this is also a test of our faith. The Muslim patient who is undergoing physical challenges of illness has a chance to exercise patience, faith in Allah's plan, and atone for his or her sins. We have the opportunity to reflect and pray and perhaps even make amends. But Islam also encourages us to have treatment when one is available. When Allah gives illness, he has also provided medical treatments. But when there is no availability of curative treatments, or the burden of treatment outweighs the benefit, meaning it will only lead to more physical discomforts and no eventual cure, comfort is an acceptable goal in Islam. This is where hospice can help. So first I'll define what palliative care is, what hospice is, and compare and contrast the both. So hospice and palliative medicine is a relatively young field. It started in the 1950s in England when it was recognized that suffering felt by those who aren't being cured of life-threatening illnesses isn't purely physical. There are added layers of psychological, spiritual, and social suffering. These additional layers of unaddressed suffering can heighten physical side effects of illness. Palliative care is defined by the World Health Organization as an approach that improves the quality of life of patients and families facing the problems associated with life-threatening illness through prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems such as physical, psychological, and spiritual. It's offered at any time of the illness trajectory. It means that it can be offered as soon as the patient is diagnosed up until they're facing no cure. This is very much in line with our Islamic views and does not oppose the idea of providing treatment, but only enhances treatments that are provided. As shown in the figure, it provides support to the, I'm sorry, you don't have the version with the figure, so I'll just tell you out loud. It's provided to the family as well. It can be offered anywhere that the patient is. So whether they're in a clinic, whether they're at home, whether they're in the hospital, palliative care is an option layered on top of whatever treatment they're already getting. And it's also an interdisciplinary team. So which means you have your nurses, you have your doctors, you have a nurse practitioner, you have spiritual care services, a chaplain, and social workers and bereavement counselors. They all are involved as part of the palliative care team, and we all work together to make decisions that are best with the family as a team member as well. And now on to what hospice care is. So hospice is a type of palliative care that is tailored more specifically for the patient who is dying. It is for those who have 6 months or less to live if the disease ran its natural course. This is just a guess based on the experience of the physician and the available data on the disease. And it's not a prediction, as we all know that Allah knows best. It has been covered by Medicare since 1983. and private insurers and Medicaid have followed suit since then. So now we'll talk a little bit about what are some of the specific tasks or specific goals that a hospice and palliative medicine clinician will try to achieve. I start with symptom management because this is the prevailing thing that we're asked to kind of take care of is symptom management. And I'll talk about actually a little bit more in another slide in a little bit more detail. The next thing is advanced care planning, which I will also talk about a little bit more in another slide. As I had already mentioned, part of the interdisciplinary team is a chaplain or someone from the spiritual care services. Like I had said, you know, spiritual distress can impact how a patient perceives their illness. And although in Islam, we are encouraged to view illness as a test from Allah and exercise patience, many who are struggling with illness will have moments of doubt and wonder if they're being punished. They'll need guidance from a spiritual leader. And that if you're on hospice and there's a chaplain, they can always reach out to the community and find someone from your similar religious background to guide you and offer you counsel. And I had already mentioned that it's an interdisciplinary care team model. Family and patient-centered care means that the care focuses on patient and family as a unit to make decisions and have serious discussions alongside their medical provider. In many Muslim cultures, this is of paramount importance, as we believe we must take care of our mothers and fathers when they're ill and respect the wisdom of elders when we make important decisions. In addition, Islamically, the dying and visiting the sick is incumbent on us. And then finally, this is what I had already mentioned, where hospice and palliative care can be delivered anywhere. So palliative care can happen at home, in a clinic, in an inpatient setting, and the hospice care is delivered wherever the patient considers themselves to be at home. So this can be in their actual home, anyone else's home, a long-term care facility, an inpatient hospice. I've even seen some of our nurses, hospice nurses, have gone out to hotels because some patients have been at hotels. And now I'll spend a little bit more time on symptom management. This is a very challenging part of illness for patients. This can cause even more distress, anxiety, things of that nature. So having excellent pain management or excellent management of anything from constipation to insomnia to nausea is part of our job. So like the hospice and pain management clinicians are experts. We've been trained on how to take care of these symptoms. And we work on finding medications that work with the goals of the family and still address symptoms. Now, what I mean by that is many times especially for the Muslim patient, being able to do your duties as a Muslim, which is pray 5 times a day and atone for your sins, you don't want to be too sleepy. And patients who are in great amount of pain then are afraid to take opioids or afraid to take medications that are going to make them too sleepy and not let them perform their duties. So what we can do is work together to find either alternative treatments or to make sure that we are titrating medications on a daily basis to make sure that we're able to achieve what the patient wants as part of their goal, because that is paramount to our job as hospice and palliative medicine physicians and clinicians, is to make sure that we are eliciting what the families and patients' goals are and making sure that we are sticking to that, along with providing them the care that they're needed. And then I mentioned a couple of the medications on the bottom. They're just examples. One of them is opioids. Another one is benzodiazepines that are used for anxiety, because a lot of times you feel a lot of distress when you're having these symptoms, when you're having pain, when you're having respiratory distress, when you're having constipation even, and benzodiazepine can help with that anxiety component. And then we also suggest fan therapy and meditation, massage, prayers. These are also types of non-medical interventions that you can do. That's integrative medicine, things of that nature. We can help talk through all of those options as well. And now I'll switch gears a little bit and talk about advanced care planning. this is a very sensitive and difficult topic for patients. Essentially, it is what decisions we're going to make when we need to redirect care and there's no meaningful recovery or cure ahead of us. And so we want to be able to assist in making decisions that one needs to make at this critical time of your life. So what we do as hospice and palliative clinicians is assist in talking through resuscitation status. And that means CPR and ventilation. CPR meaning chest compressions and reviving a patient. Ventilation is when you use artificial ways of helping the patient breathe. Artificial hydration is another thing we'll talk through and see whether it's beneficial for the patient at that point or not. And admissions into the hospital, that's another thing you want to think about, whether this is necessary for multiple admissions into the hospital and whether it aligns with the values of the family and goals of the family, or if it reduces their quality of life. These are things that we have to have honest and open discussions about what is medically feasible while aligning with the family's goals. And when I talk about goals, I'm talking about comfort versus prolonging the life of the patient versus cure of the patient. So these are all things that we are trained to do and know how to do with the family while respecting their religious and cultural values. So the role of the palliative care clinician, if a patient is in the hospital, is to make sure the patient and the family's values and beliefs are heard and considered in decision-making, and that medical team is being transparent as possible. We also serve as a bridge that ensures solid communication between all the team members involved. We can be present at medical discussions and then debrief with the family afterwards. Other things that we talk through are planning living wills, how to redirect care, what redirecting care means, stopping nutrition, medical technology, such as ventilators. Talking about all of these things and planning ahead is actually permissible in the view of many Islamic scholars, since comfort and ease of suffering are encouraged in Islam. Now I'll talk a little bit about what does redirection of care mean. So I had alluded to this in the previous slide. Muslims are strongly encouraged to undergo treatment with curative intent, as long as the side effects are tolerable. But you might come to a crossroads when you see that the side effects are not tolerable or that there is no curative intent. And then you have to rethink what is the best option. Muslims are not obligated to undergo treatment that may cause them more harm than benefit, meaning it causes many side effects, or you aren't able to fulfill your obligations as a Muslim. But there is no cure. So redirecting care means choosing comfort, choosing not to put the tube in, choosing not to take harmful chemotherapy. You know, these are the things that can help you have a better comfort. We can help give you comfort if there is no cure available. And this slide talks about, you know, when you're faced with grief and bereavement. Islamically, we're all on the same page. We already know what the bereavement periods look like. And we know that many of us have good community and family care and support during the bereavement period. However, this isn't the same case for everybody. So hospice can add additional layers of care. They have bereavement counselors that can help with family members who are grieving the loss of their loved one. And they also provide social work. So social work has many great resources that can help you figure out as a spouse, what are your benefits? What are your spousal support benefits that are available through Social Security or whatever the case may be, and what other resources are available. So hospice, you can always talk to them too and say, you know, this is not the right time. We're in their bereavement period, and they will be respectful, and you can reach back out to them when needed. And they can also be there in the beginning when you're grieving, but always know that hospice is very flexible and they are able to provide support when needed and will also respect your space when needed. And then some bereavement support. I mean, you all already know about a lot of these things. and I'll go back to that in a second, but how our clinicians can help. We can assist connecting you with other families, connect with local Muslim resources, which Hala will talk a little bit more about, and other resources that are available for charitable organizations. And then psychological support is available. It's not commonly used by people from the racial and ethnic minorities. It's a little more stigmatized than it needs to be, but those resources are available as well. And that's my quick overview of this topic. Hala, or does anyone else have anything they want to add? Or
Hospice team, anyone would like to add anything?
Yeah, can I add? It's just a question, not adding. It's about what about assisted, like if someone asks for opioid many times and then eventually he will end up by respiratory depression and he will die. Is this considered like something we can do it as a Muslim or for us, like for a physician, to do it like assisted suicide, for example, or giving as needed? Suppose someone with respiratory problem and he's asking for a lot of morphine or opioid. Can we do that, or that wouldn't be acceptable?
so life in Islam is considered a sacred trust, and taking it in any way, shape, or form is completely against Islam. So when you bring up respiratory distress, part of hospice and palliative medicine physician is we can give opioid, like you had mentioned, to relieve some of the respiratory distress, but only to the point of helping with their anxiety and their respiratory distress symptoms, but not to the point of taking their life. So we are able to actually titrate these medicines so it doesn't get to that point. But yes, you're right. I mean, it's against Islam to actually do assisted suicide, and that's not something that is also allowed by the Hospice and Palliative Medicine. So Academy of Hospice and Palliative Medicine does not allow it either.
Thank you.
Would anyone else like to add any questions? Does anyone have any questions? I have one for you, Dr. Han. It says, my family already cares for me. What additional benefits would hospice or palliative care services offer me?
Exactly. That's a good question. So the question was, oh wait, let me make sure you guys can hear me okay.
We can hear you.
Okay, good. Can you hear me now?
Yes.
Okay, good. Yeah, so that's a great question. Like Dr. Madni mentioned, hospice and palliative care, both services offer additional support for patients and their families. And that support can be in the form of medical providers ranging from physicians to nurse practitioners, PAs, nurses, medical aides, and so on. Typically, let's take a hospice team, for example. A hospice team, when, let's say, they come to your house, you want them to come to your house. When they come to your house, they have a team of people that they send several times a week. And if more care or more attention is needed, they can come out more frequently as needed. And typically the team consists of a nurse who has expert training in caring for patients who are on hospice. And you also have a medical aid if needed, if you need help with transferring the patient from a bed to another bed or to a chair, help with bathing and toiletries, etc. They also provide medical equipment like gauze and dressings for wounds that need to be cared for, suctioning, oxygen, they provide all of that. A hospital bed, if you need that, they also provide that. And if you need medicines for symptoms, like if you're having nausea, they'll give you medicine for nausea. Pain, they'll give you medicine for pain. They also have a chaplain that's part of the team. And chaplains are non-denominational. They generally come and speak and counsel about things you might be feeling. They don't try to preach a certain religion or try to convert people. That's another layer of support. You also have a social worker who can also provide counseling and also provide resources in the community as well. And so it's an entirely team-based approach. And you have a lot of resources where the primary goal is, like Dr. Madni said, the comfort of the patient and to make the last days on earth kind of as peaceful as possible, because Allahu Alam when somebody's going to die, but we can provide comfort, and that's the goal of the team.
Thank you, Dr. Khan. Please feel free to also type your messages in the chat box if you're not comfortable saying them out loud.
I have a question.
Please, go ahead.
So I wanted to ask, it's two questions. And one question is, sometime the patient who's gone through an illness, catastrophic illness, for some time is ready to be on hospice, or they've fought long and hard, but family comes in and say, you're giving up, and they, and try to convince otherwise. And, how do you see, have you seen this, and how do you deal with it?
Simply click on the file and
So I'm happy to answer from my experience. I'm in pediatrics, and I've seen it from more than just the child, but although some children are very sophisticated and are able to say that they are ready for hospice, but families who say that they're ready for hospice, and then they have external family members come in, grandparents, and say that exact thing that you said, you're giving up and you're not trying hard enough, and it can cause a lot of distress for families. And so in these situations, what we do is kind of have family meetings and involve these extended family members and ask them what is their kind of their thought process behind that. What do you mean by giving up? What does giving up mean to them? And what are their goals? And kind of working with them. And sometimes you find out a little bit more what their actual fears are. And it may not be the giving up part, but it might be something else completely that you unveil, and you're able to talk them through it and eventually get everyone on board to understand that hospice is not giving up and palliative care is not giving up. It's actually giving them an extra layer. It's giving them more support. It's giving them a chance for comfort. And eventually, when you have these kind of open conversations and try not to make any assumptions about what they mean, you can end up having a pretty good discussion and finding that the families end up trusting you and you can make these decisions together. Sometimes they just want to be involved in the discussion. So that's kind of my experience, but I'm sure Shan and I'll have different ideas too.
Can I add something?
Of course.
Yeah, I definitely like what Dr. Madni said. Communication is key, and keeping in mind the family's values and their kind of approach to illness. So like Dr. Madni said, hospice and palliative care started and kind of follows a Western model of medicine, especially in the United States, where you have patient autonomy, right? The patient gets to decide. Oftentimes, of course, the family is involved and the family wants to help and make decisions. It's definitely important to have everybody kind of communicate together, like Dr. Madni said, and that definitely helps. And I've seen a lot of catharsis and kind of pathos when it comes to families kind of getting together and talking about things all in one room and expressing their concerns. And then to kind of also from the care team's perspective to say, we don't give up. We don't stop treating our patients, as one of my mentors likes to say, we don't ever stop treating patients. And we always treat patients. The direction of care or the goals might change, but we always want to treat our patients according to what is best for them, according to what they believe is best, and from our perspective as well.
I have a question. Please feel free, who would like to jump in and answer. Can people transfer in and out of hospice, and how is that determined?
So I can try to answer that question from my experience and perspective. But patients can enroll on hospice, and there's two ways of kind of determining it. One is if, so they, first of all, they get enrolled on hospice when two physicians, one being the hospice director, one being their primary physician, decides together that this patient indeed has a life expectancy of 6 months or less if the disease follows its natural course. And then if they are, then they have to be recertified after several months. And if they have not, if they're not meeting that criteria anymore, then they can be disenrolled by the hospice. The patient and family themselves, if they feel like hospice is not the right move for them anymore and are not comfortable with that, they can unenroll themselves as well.
Thank you, Arshia.
Can I?
Go
I'm
ahead.
sorry. Can I also ask Dr. Madni, can you also talk about pediatric hospice versus adult hospice, like in terms of the level of care offered and concurrent care and that type of stuff?
Right. So for pediatrics, the definition of hospice is a little bit different. So they can be for definition that I just said, but they can be on it while receiving disease-directed therapy as well. So they don't have to be necessarily with 6 months or less left. They can be enrolled for a really long time. So for example, we have one patient on our hospice that I am part of that has been on hospice now for maybe 5 years, because he can get both therapy and also be on hospice at the same time. So that's what's called concurrent care that Dr. Khan was referring to. So yes, the definition is a little different in pediatrics.
Okay, thank you. I have a question for Dr. Hakeem. What do you think are the needed areas of improvement for the palliative care of Muslim patients, and how can they be addressed?
Yeah, Jazakumullah khair. I think, as was mentioned before, open, transparent communication is very important. So on one hand, the healthcare providers and the hospice care team may not be familiar with the needs, faith-based needs of the Muslim patients. So we know, like, we may have some dietary restrictions. We need to do prayers and not get interrupted. Some patients want to dedicate some time to read Quran, for example. So some needs are more towards Islamic faith, and the healthcare providers may not be familiar with this stuff. On the other hand, I've seen Muslim patients or Muslim families kind of shy off voicing their needs. So at the difficult times that they're going through, they kind of prioritize things, and they do not really communicate what their needs are. So it's kind of on both sides. It's really needed from both sides. And I'm sure healthcare providers are really welcoming any information or being honest and listening to the patient and their family about what they need specifically, and to learn about their faith to meet their needs. So I would say, just be open and talk about your needs as a Muslim patient to provide the best care for you. And I also encourage usually the healthcare providers to just ask. So some healthcare providers don't feel comfortable asking due to the fear that they may interfere with personal beliefs or something, but this is not the case. So this is something we always need to encourage the healthcare team to feel free to ask the patients what they want specifically. So being open in communication is an area that I feel we still need to better understand and to better work on, so that both sides or both teams will be able to work together to achieve the best needed for the patient.
Thank you, Dr. Hakeem. We have a question in the chat box. Is this treatment covered by insurance? And what if someone is uninsured? Who is responsible for the bills if the patient passes away?
So I can answer the part where I know that this is, covered by insurance. It's covered by Medicare, Medicaid, and private insurers also cover hospice needs. If you cannot afford it because you're uninsured, some hospices do have resources and methods where they can help you. As far as the bills, I'm not completely clear on. I don't know if someone else has an idea.
Yeah, so typically a lot of the hospices, they don't send a bill to the family. They
Right, but if
usually,
they're not insured, they have no place to send it to, right? They have to send it to somewhere.
right, yeah, so they, like for example, and again, this is not sponsoring any hospice or endorsing any hospice. This is just an example. Methodist Hospice, for example, they have a charity arm, and I believe Baptist does too. And what they do is if people don't have insurance, then they use money from that fund to pay for their hospice services, essentially. And they don't send a bill to the family of the patient in that case.
I think also the Medicaid doesn't cover the stay in the hospice. For example, in Baptist Hospice in Germantown, for example, I don't want to endorse anything, but the Medicaid doesn't like pay for the stay for the day, which almost cost about $190 a day. So the patient has to like pay on his own for the stay, like in the room. So staying in the room 190, he's already responsible for it. This is from my knowledge. And it can cover the other things like the medications, but the stay itself as like being in the place. So the day cost 190, it's not covered by Medicaid.
So can I answer that?
I'll have to look into that. Yeah, Shan, please.
Yeah. So what you're talking about, sister, is a hospice house. And Dr. Madni mentioned this, but just to review, hospice care can be provided in the hospital, in somebody's own house, in a nursing home, or in a hospice house, which is, so everybody knows what all the categories are except for hospice house. A hospice house is a medical facility where people who are on hospice, whose symptoms cannot be controlled at home, or if they can't go to a nursing home or be in the hospital, they go there and they stay there and receive hospice care there. The hospice care is paid for by insurance, Medicare, Medicaid. The room and board, because the facilities charge a room and board, as if, if you're going to a hotel, we pay for the night. The room and board, they ask that you pay for that. And that ranges anywhere from, like the sister was saying, 190 to 200, 250, depending on which facility you're going to. In Memphis, there are two facilities at this time. Methodist has the Methodist Hospice House on Quince and 385 Kirby Parkway. And then Baptist has their hospice house in Collierville, behind Baptist Collierville. And I'm not sure if Le Bonheur or St. Jude do a hospice house type thing or not, but that's anyway from the adult side, that's what they do. And then if you're at home, of course, your insurance or the charity would pay for home hospice or nursing home-based hospice. I'm not sure what they do for the pediatric side, Dr. Madni or Dr. Hakeem.
I mean, from the pediatric side, everything is covered. So.
Thank you. Dr. Nabil, are you with us?
Here.
We have a question for you. What are our responsibilities to the family in the hospice from an hospice care from an Islamic perspective? What are the typical needs of the patient from the family? Can you elaborate on that? And how can we best support, to my understanding of the question, patients that are in hospice care and their families as a community?
Well, we know that in Islam, that visitation rights of the patient, as the hadith of is hadith Qudsi, that Allah subhanahu wa ta'ala says, Marudtu abdi walam tazurni. Oh, my servant, I got sick and you didn't come and visit me. And then the person will ask, oh, you, the Lord of the world, how can I come and visit you? And then Allah subhanahu wa ta'ala will respond, say, Abdi Fulan, Marida Abdi Fulan, my servant so and so got sick, and you didn't come and visit him or her, and have you visited her, then you would have found me there. And you know, the hadith, the narration continues. So the point is that as Muslims, then we are actually to give that kind of support, and this is actually it's a great support. That's what I'm trying to say. It's really, this is the psychological support that making a person feel like they are still part of the community, involve them in, like, ask them opinions of certain things and all that. Don't they make them feel like they are really insignificant? Like you going there and asking them, you know, talking, you know, things that makes them feel, you know, bad or anything of that nature. Just let them feel like they're still with us. They're important. Their decisions, their opinions are important, and so on. And also that's for it goes the support also for the family. You know, family who are taking care of person in a hospice or palliative care. It's a big psychological pressure on the individual, and also physical. You know, it's not easy to keep on going back and forth, or even if the person is with you at the house. You know, a lot of side effects can happen actually from taking these medicine, and the toll of it over the long time becomes very, very, you know, pressuring. So as members of the community, inshallah, and we should really come also ask, like, do you really need any help? And be genuine in asking these questions. You know, it's not like sometimes you say, do you need any help? Okay, salam alaikum, bye bye. You know, I'm gone. No, really ask, do you need any help, and be sincere about when you say, because this is really, really a major, serious thing. Taking care of an elderly, I think Dr. Madni already said, you got a lot of blessings from it. You got a lot of rewards for it. And, you know, so the person who wants to do this, then they should understand that this is an opportunity for that individual actually to make all these rewards and treat it in that manner. So whatever support, like for the family, like if you feel like they overwhelmed with work, if you need to go pick up their children and you have the ability to do so, go ahead and pick up their children. If they need any shopping, are you going shopping? You know, phone call, look, I'm at you know, wherever place you shop, and do you need anything that I can pick up for you? You know, treat them like you know, like you're members of your family. That way, actually, the pressure of the person who's taking care of an elderly individual will be lessened, inshallah. And of course, dua, always continuously make dua. Allahu alam.
Jazakallah khair, Bayakly. Okay, I do have one more question for Dr. Khan. Will I be required to take sedative medication around the clock? Because I'm worried about it impairing my ability to pray and read Quran. How basically do sedative medications take place or part in the hospice care?
That's a very good question, Jazakallah khair. A lot of people, when they hear the word hospice, they think of either death or being doped up or knocked out. And like Dr. Madni was saying in her presentation, the medicines that we can use, that we are trained to use to relieve symptoms, can cause some drowsiness and sedation. And again, the goal is not to knock somebody out, right? The goal is to relieve symptoms. And this involves having a conversation with the patient and their families about balancing the need for relief of symptoms, relief of suffering, relief of pain, and allowing the person to be conscious enough to make dua, to pray, to speak with the family, to be interactive and not kind of be knocked out laying in bed. And so after having that conversation, you can prescribe the appropriate dose of the medicine and teach the family how to take that in the way that is best fitting with that family and the patient's needs. And you can have medicines that can help with anxiety, with pain, they can make you sedated again. But if you have that conversation and then you set those boundaries in terms of this is how much you should take it, you know, these are the times that you should take it. And then of course, communication, leaving it open, saying, call me if you have any questions or need to change anything. I think that approach tends to work pretty well for patients.
Thank you, Dr. Khan. I'm not receiving any more questions in the chat box. Does anyone have?
Sister Hala, I just wanted to add to Dr. Khan had said, just not to think that when hospice is involved, that medications have to be involved. It is not required to be on any type of medications. It is purely supportive care, and medications are indicated only when there's symptoms. So not to think that because, you know, you're hospice, you have to be on medications 24/7. That's not the case at all.
Thank you. Thank you. Okay. Does anyone have anything else to add?
I wanted to ask a question for Dr. Bayakly. You know, for patients who are coming near the end of life, you know, of course, for the families, dua is such an important aspect of our lives, and we're constantly making dua, but some family members will oftentimes, they just want a dua for a cure, and the life is ending. And where do you transition, and how do you help community members who think, well, we're always supposed to have hope, but at the same time, family needs to be prepared for the end of life?
Yeah, I mean, a lot of times I'll have conversations with family members who will say that they are still hoping for cure. And, you know, I hope the same. I always hope the same. And I tell them that I hope the same. And, you know, I tell them that I'll pray with them that their family receives a cure, their patient receives, you know, their sick family member receives a cure. And I said, but, you know, in the meantime, today and tomorrow, what do you want those days to look like? How can we make those days the best days possible? And how can we treat the symptoms that we have before us right now? So that is kind of how I handled those situations, because robbing someone's hope from them or telling them not to pray for cure is not the right thing to do. You have to always encourage them to keep praying and to keep hoping. And I always, as a physician, I'll tell you every day, I hope that I'm wrong. And every day I hope that when I tell a family that their child doesn't have a cure, that I'm incorrect, and I can go back and tell them that I'm wrong.
Thank you, Dr. Madni.
Alhamdulillah, I think Dr. Madni did answer that. And the point I think Dr. Madni says that we live our life one day at a time, and always, you know, expect the worst and hope for the best. You know, so if we have that attitude, actually, I'm sure all of us, we don't know actually if we're gonna live for the next minute, as Islam tells us. So, and we should always be prepared. At any time, any moment, we should always be prepared. Of course, you're not going to tell this to somebody who is on a patient, you know, on bed, but mentally, that's how we should be ready. Mentally, for everybody, whether they are in hospital or outside the hospital, that's the attitude of Islam. And in a way, for the patient, as Dr. Madni said, you always have that attitude, live one day at a time, and then, and you know, do your best, inshallah, and tomorrow is going to be better, and you know, things of that nature, inshallah. For the parents, you have to tell them is that life is life, and nobody knows when we're going to leave this world. So it's all in the hands of Allah. And if anybody survived or could have survived death, or if death, you know, then the Prophet Muhammad ﷺ could have, but he also lost his dearest individuals. His kids, you know, died So we are not better than Prophet Muhammad sallallahu alaihi wasallam.
That is one thing I always try to tell families too, is that I can only tell you from my experience and what I've seen, but really I'm not in control. None of us are in control of what happens.
Thank you. Viewers, do any of you have any questions? Okay. Dr. Hakeem, one last question, if you don't mind. How
Sure.
can family-centered, how can a family-centered care be practiced in hospice and palliative medicine?
This is again, that's a good question, because many people think that hospice care is mostly focused on the comfort of the patient himself or herself, and does not take into account any family needs, which is really not true. Because actually, as Dr. Madni mentioned in her presentation, this is a multidisciplinary team who are providing care to the patient. And that team includes social workers, psychologists, and from the pediatric perspective that I'm familiar with, the child life. And these members of the team are very important to provide this care as a family-centered. For example, again, an example from the pediatric perspective, usually when having a sick kid, the parents have all their focus on the kid, and they tend to leave the other siblings. They feel that they are left behind, or left out of the entire picture. So, which is really a lot of psychological and emotional pressure on the siblings when they see their, sick sibling going through all of those difficult time. And this team provides support to the siblings, how to cope, for example, with those difficult times, how to cope with those emotions and the psychological pressure. So this is an example of a family-centered care. So it is perfectly aligned. I mean, both the hospice or palliative care that is in principle, we understand it only focused on the patient. Actually, it's entirely family-centered, including the sibling from the pediatric perspective, which is something that always we pay attention to and not to be left out. So I don't see any contradiction between both. Actually, they are completely in alignment with each other because it is family-centered care.
And if you recall the original definition of the WHO that I had presented to all of you, it actually said the patient and the family's
Yes.
symptoms. So it's totally aligned, like Dr. Hakeem said.
Jazakumullah khair, and thank you all for all you do. Excuse me, I want to thank everyone for joining us today. Please join us next month for part 2 of this 2-part webinar, where we will be introducing to you a place here that the hospice team has been working very closely with and trying to make it as Muslim friendly as we can. So thank you all for being here today. Jazakum Allah khair, and thank you. Goodbye, everyone.
Thank you, everyone.
Assalamu alaikum.
Assalamu alaikum.
Jazakallah khair.